Hi there, welcome. I'm giving everybody just a few seconds to log in. I know that some may still be joining us. If you feel free to chime in the chat or come off mute if you're willing to kind of tell me where you're coming from, what practice setting. I'd love to hear kind of who might be in the audience tonight. Again, we're just waiting on a few people to log in. It looks like some viewers are popping in, so just trying to give everybody a second. All right, so it looks like we've had some people join in. I hope you guys can hear and see me okay. I'm Dr. Ashley Bowman. I am an assistant professor at the University of South Alabama. But I'm also a pediatric nurse practitioner in the pediatric emergency department here in Mobile, Alabama. I've been working there a little bit over 8 years. So we do see children who have experienced ingestions, and the title of this talk tonight is Accidental Ingestions. NAPNAP reached out to me to do this talk. Primarily, I think because I had done a talk back in 2021 at our national conference. Unfortunately, that year had to be virtual due to COVID, but I'm here tonight to hopefully give you guys some updates, pearls, really just reinforce some of the highlights from the world of ingestions and maybe some of the updates. Thank you, Cassandra, tuning in from Casey and work in urgent care, so that's helpful. So it's helpful to hear where you guys are from, so I know if you're dealing with primary care or that if you're actually in an inpatient setting. So ingestions, really the nuts and bolts of what's going on in the world of ingestions they're still very common, particularly in young children. Accidental ingestions still occur primarily in children under 5 years of age, roughly 44% of all ingestions. And the mean age, from some more recent statistics, was about 30 months. So they're right around that time when they're highly mobile, but prone to getting into lots of substances. Our small children are definitely the ones we're looking at for accidental ingestions, but of course in the ED we see many intentional ingestions in our adolescent patients, and there really is kind of a whole separate body of literature on that topic that I really can't cover in such a small talk tonight. I couldn't even cover that when I did this in 75 minutes at conference. Ingestions are the fourth most common reason to come to a peds ED. So like I said, I've been working there a little over 8 years, and we still see lots of ingestions. Really, those numbers haven't changed a lot with time. It really takes a long time to see some trends, but things that are getting ingested might change in the trends. Medications are still the most frequent type of ingestion, around 40%, whereas there are some ingestions that could occur by other routes, like don't forget about contact or inhaling things. We definitely see a fair share of those too, but tend to not be as problematic for the most part. And the good news is the majority of accidental ingestions are fairly minor. So for you guys out in urgent care or maybe in primary care, most of these ingestions that we see, we may monitor for a period of time recommended usually by poison control, but then they get to go home. There are some that are hospitalized. The rate of hospitalization runs about 14% in some of the more recent statistics I was able to pull, whereas a PICU hospitalization is only about 5%. So you can see that most of these are fairly minor and dischargeable from the ED. The most common things that are ingested also really haven't changed much. It's it's trending along where you still see a lot of detergents or household cleaners, and medications, alcohol, um, is and also drugs of abuse are problematic in particular, and we'll talk about those a little bit more in a few minutes. Pesticides, kids may even get into certain types of toxic plants, and so just knowing what the exactly is, as much as what they ate and how much, you're going to need as much detail as possible when you call poison control for recommendations, especially when we get into these more unique substances. And then remember that they can ingest things that are not medications. Like kids are still ingesting those small magnets or button batteries, laundry pods, although that's gotten better with a lot of the proactive stance that's coming from the industry. And then also I feel like people are just more aware that that's happening. You see commercials and things around the pods that used to not be around. One thing that did pop up in the more recent literature is tiki torch oil. There have been some cases of kids ingesting that because the packaging that it comes in looks almost identical to apple juice, and so that's a little bit confusing to a small child. And also hydrogen peroxide can be problematic because it doesn't irritate the mouth much, and so kids just tend to swallow it easily. So remember that how much they've taken is really important, because some substances are toxic in very, very small amounts, whereas some it would take a load. And so usually the child, if it's not a really obnoxious substance, they're going to take a little bit and hopefully not want more. So it's important to kind of get that out of parents, and so hopefully again it's a small enough amount to where it's not causing a lot of morbidity and mortality. And the other kind of new trending thing is vaping liquid, because vaping is become such a prevalent habit of adults that children can get into the liquid in the vape itself. Ingestions still happen most often in the care of mom, but don't forget about grandparents and other caregivers when you're giving your education. That way everybody who may have contact with this child really understands what it takes to keep them out of these harmful substances. The important things when we're assessing a patient, like for Cassandra and the urgent care, like those frontline providers in particular, it's still very important to get a full physical and vital signs right away in any setting. I mean, we do this already, but we'll be looking at certain parameters with blood pressure, or maybe you're doing a full neuro exam, like are they having GI symptoms. All these things can be helpful, especially if the substance was unknown, because you may be trying to match up with one of the common toxidromes. I don't really have time to go over all of those, but there are still those very common toxidromes that we see. So once an unknown substance, we see this in the ED, we kind of have to sift through what we're seeing and think about what we might want to do next. And then I really wanted to make sure we touched on fatalities. So the talk that I gave in 2021 really centered around ingestions, accidental ingestions of substances that are toxic in 1 or 2 doses. So we know that there are lots of ingestions, and like I said, most of them are outpatient managed. They're minor, cause very little, if any, negative complications down the road. But there are a list of substances that are known to be toxic in very small amounts, and so if toddlers or preschoolers get a hold of these medications, the fear is that they could be fatal in just that little dose. So that's where we really have to focus a lot of effort in keeping them out of those medications. Thankfully, overall fatalities in the more recent literature are coming down. So while ingestions kind of still happen and it's a very just a part of this stage of growth and development, the fatalities overall are down. However, the more problematic thing that we're seeing now, even more than we have in any recent years, just climbing, are the opioid fatalities. So while fatalities overall are down, opioid fatalities are climbing, and they're now the leading cause of fatalities in our young children under 5. So the opioid epidemic, while we focus so much on the adult population, is really affecting our kids because there are so many adults with opioids in the home or access to opioids. Those same toddlers are getting into those as well. And likewise, one of the kind of emergent drugs on the 1 to 2 dose list, that high fatality list, is buprenorphine, because there are so many adults who are receiving that therapy. It's becoming more and more available to our toddlers. So some of the guidance, I think any of us, but particularly if we have anybody in here from primary care who's doing a lot of anticipatory guidance, talking about those safety guidelines, whether it's a caregiver, the primary caregiver, or maybe it's just a family member who sometimes watches this child. Again, don't forget about them, who receives buprenorphine. We need to make sure that we're talking about safety and how bad this drug could be in just a small dose if the toddler was to get a hold of it. And then also thinking about prescription for naloxone in these households in the event that a toddler, preschooler age child was able to get a hold of those small dose medications, that they would have naloxone on hand as a reversal. Some of your other 1 to 2 dose fatality drugs are some cardiovascular meds, some of the sulfonylureas, psych meds, and then some of our seizure meds. So those have not really changed a lot with time. They're still out there, but the opioids have become really the most concerning thing because we're seeing so many opioids everywhere, and again, just trickling down to our kids. So that's kind of really the highlights of everything I wanted to share in this brief update about the world of accidental ingestions, and leave just a couple of minutes for any questions from the audience. I'd be happy to kind of chime in with some bits and pieces. I know that was brief, so feel free to pop them in the comments. But I hope that was helpful to kind of overview of where we are. But in short, not a lot has changed, but thankfully fatalities are coming down, but those opioids are on the rise and now causing our biggest problem. Just giving a few minutes for questions, in case there are any from the audience, but I just appreciate you guys logging in and listening for just a few minutes. All right, hearing none and seeing none, I guess I will sign off for tonight. Thank you again for joining, and hopefully that was helpful.